Hi, we're talking about survivors of sexual assault, their health concerns that face that population. Survivors of sexual assault are individuals who have experienced sexual contact or behaviors that occurred without explicit consent being given. Sexual assault includes attempted rape, fondling or unwanted sexual touching, forcing a victim to perform sexual acts such as oral sex or penetrating the perpetrator's body, or penetration of the victim's body, also known as rape. Sexual assault can affect individuals from many different groups. It occurs across all boundaries and involves all genders, races, religions, and socioeconomic classes. Survivors of sexual assault have experienced something very traumatic. This trauma can affect the way the survivor interacts with the world around them. The rape rate in Ogden, Utah in 2008 was reported by the FBI to be 84 per 100,000 people. This is much higher than Utah's rape rate that was reported at 55 per 100,000 people. It is also much higher than the national rape rate that was reported as 43 per 100,000 people. Utah is lower than the national average for all violent crimes except for sexual violence. Utah has had a higher sexual assault rate than the nation for many years. Current statistics state that 1 in 3 Utah women will experience sexual violence in their lifetime. 1 in 6 women and 1 in 25 men will experience rape or attempted rape in their lifetime. When dealing with social determinants of health, social and community context could present a barrier for survivors of sexual assault. The majority of survivors of sexual assault have been victimized by someone they know, like a family member or acquaintance. This indicates an alteration in normal, healthy relationships in the survivors' families or social groups. Social stigmas or cultural beliefs like victim blaming can also affect the available support for victims of assault. These factors can contribute to the victim's unwillingness to report the assault and therefore undermine their ability to gain access to needed therapeutic interventions. Risk factors that may be contributing to Utah's high sexual violence rate include things like strong patriarchal family relationships and belief systems, general tolerance of sexual violence within the community, weak community sanctions for perpetrators of sexual violence, and poor policies and laws regarding gender equity. Risk factors can also include drug and alcohol use, hostility towards the vulnerable population, family histories of sexual abuse or violence, beliefs in male superiority, or sexual entitlement. Georgia State University sees the opportunity to study motives for rape when anonymous self-reported rapists posted responses to a question as to why they committed their assaults on a social media platform known as Reddit. More than 12,000 posts were reviewed and categorized. The first-person account studied revealed the most prevalent justifications reported for perpetrating rape were sexual scripts, like no really means yes, victim blaming, like blaming the victim for what they were wearing or that the victim was flirting, hostile sexism, which is contempt towards the gender of the victim, usually perpetrated as a punishment, biological essentialism, which is blaming out of control hormones for your actions, objectification, which is the dehumanizing of the victim, and sociosexuality, which is collecting as many sexual partners as possible. Most cases exhibited multiple themes as justification. Psychological injury and trauma are the major root cause of health disparities that survivors face. The effects of trauma can permeate multiple aspects of the survivors' lives. Post-traumatic stress disorder is common for sexual assault survivors. Complex PTSD occurs more frequently in childhood trauma survivors due to the recurrent nature of their traumatic events. This affects how survivors interpret the world around them. Many survivors experience high levels of distrust in the people they interact with. Many survivors experience PTSD, complex PTSD, depression, anxiety, gastrointestinal disorders, hypertension, eating disorders, migraines, and sleep disorders. These health concerns can all be linked to the individual's trauma response. This affects the kinds of treatment they are willing to seek out or accept from mental or medical health providers, because many of the interventions used or the response of the provider to disclosure may trigger this trauma response. Maslow's hierarchy of needs suggests that needs progress from a basic needs up through the pyramid to the pinnacle of achievement in reaching an individual's full potential or self-actualization. The response experienced by survivors of sexual assault varies greatly and is part affected by the severity of the assault, the support system surrounding the survivor, and the treatment that they receive. As the severity of the assault increases and the available support systems or treatments decreased, survivors have fewer of their needs met. At the time of the assault, victims are experiencing a situation where none of Maslow's hierarchy of needs are met. They have been physically harmed, are not safe, are not experiencing a loving relationship or belonging, generally experience self-esteem issues, and are not in a place where they can progress towards self-actualization. Many survivors relive the effects of these needs being unmet throughout their life, but with support and treatment, they can move through the experience and begin to meet those needs as they progress from victor to survivor and then to thriver. Overall function of survivors of sexual assault may vary throughout the survivor's lifetime. Data shows that about 29% of survivors experience more poor physical health days than individuals that have not experienced sexual violence. Nearly 43% of survivors experience more poor mental health days than those who have not experienced sexual violence in their lifetime. This suggests that 43% of survivors experience difficulty meeting their psychological needs, and 29% experience difficulty meeting their physical needs, but the level to which their needs are met is varied throughout their lifetime. Surviving sexual assault can affect an individual's mental and physical health and even affect their ability to concentrate or accurately remember things. They have higher incidences of behaviors that increase health risk, like binge drinking, smoking, and difficulty independently doing errands. Survivors of sexual assault are at risk for communicable diseases like sexually transmitted diseases or bloodborne infections like gonorrhea, HIV, chlamydia, HPV, syphilis, or hepatitis. Post-assault interventions like STD prophylactic medications and testing can be provided along with Plan B or the morning after pill to prevent unwanted pregnancy as a result of the assault. Survivors are also at high risk of developing non-communicable diseases or conditions like depression, anxiety, PTSD, complex PTSD, and even personality disorders in more severe cases, addiction, and unwanted pregnancy. Survivors are at higher risk for suicidal thoughts and self-harm. They also experience a higher rate of high-risk behaviors like promiscuity, binge drinking, smoking, eating disorders, and substance abuse. Some survivors have difficulty completing daily tasks like running errands alone and may experience self-neglect. These effects can be improved through an increase in their support system, like identifying safe friends and family members, or community supports and therapeutic interventions like counseling or psychotherapy or pharmacotherapy. Survivors of sexual assault have a higher incidence of re-victimization. The occurrence of secondary assault is even higher among those survivors who experienced their first assault in childhood. All of these risks can be addressed by improving therapeutic interventions and resources for survivors. Prevention could be improved through addressing social norms that promote sexual violence, improve gender equity, promoting problem-solving skills in nonviolent ways, and improving community support. Thanks for listening to my presentation.